You ready? All right. Let's call the November 1st, 2016 Health Committee meeting to order at 10:36. All members present, Mr. Whitlow. Are there any public comments? Are there any agencies here to report? Dee, could you please give your report from the Iroquois County Public Health Department?
I didn't bring a grant contract for you. We have changes in the last one I gave you. We are still waiting on contract numbers, like I said, for EDS. We cannot submit any of the IDPH grants for reimbursement right now because we don't have my contract numbers. No one in the state does. We do have our federal grant numbers, public health emergency preparedness with from the Department on Aging, but none of the IDPH grants. We're still unable to send off the WIC EDS, even though we have a contract number with that, because of the new data requirements with the state of Illinois. We're waiting on state guidance for limits for indirect and direct costs for sub-awarded grants. And because we're only one of two sub-awarded grants in the state for WIC, this is new for them too. And we've been in communication with them. Linda Butler from the Department of Human Services has recommended that sometime over the next few weeks we set up a conference call between ICPHD, your Birmingham Hospital WIC program, DHS, and the state DOTI, which is from the Governor's Office of Management and Budget, to figure that out. Here are the summary reports. Somebody must have got mine with me. So if you have one that's got some writing on it, let me know. I think I missed it the other day with mine. With the back. Sorry. Is that it? No, I've got extra. I have one with notes on it. No, there it is. Okay. Thank you. So you can see under food sanitation the number of inspections and permits that were issued, re-inspections that were done. The number of water samples was down a little bit this month. We only did 10. Of those unsatisfactory, please don't misunderstand it thinking that 6 of those 10 were unsatisfactory. Sometimes we have month carryover ones that were sent in from the month before don't come in. So, you can see number of wells and inspections and surveys and new wells and wells sealed. Number of radon kits, we're out of radon kits. We have to order. We ordered them by a case of 100, so we hadn't had to order any for a long time. We're out, so we have to order another case of those. Complaints were down a little bit this month, which was really nice because the staff was extremely busy with normal things. Community health numbers are up greatly, as you can see. 1,000 immunizations, more than doubled from September. That's because, quite frankly, the October 15th school deadline, the state school deadline for school children to be immunized in order to remain in the public school system. So we'll pass the October 15th deadline, so next month those numbers will go down, obviously. Adult immunizations were up just a little bit. Obviously flu, we're right in the middle of flu season, we're still giving flu shots. To date we've given, I should say as of yesterday, we've given 586. We still have flu clinics going. And 78 pneumonia vaccines were given. 77 of those in October. under the reportable disease investigation, animal bites were up a little bit. If you'll look under where it says rabies investigations, two of those animal bites required post-exposure prophylaxis. And then as far as the rest of the diseases down the list, you can take a look. If you have any questions, just ask. Under community outreach events, we had 20 food clinics. 19 of those 20 were outside of the health department. One was an evening clinic here. Some of those clinics were, most of them were public, but a few of them were private clinics where we go to, like, for example, Dr. Martin's office, or to, the art and get food shots. Numbers are picking up, obviously, for vision and hearing screening, because we're back in session and going. I think the rest of it's pretty much self-explanatory, but if there's anything you'd like me to go over, I'd be happy to do that. We do have an open position at the health department. It's been posted on the county website and our page as well for an associate sanitarian. The position requires a bachelor's degree with 30 hours of 30 semester hours of sciences or 45 quarter hours of sciences. And those are requirements that the state requires in order to sit for the LEHP exam. We could also hire someone that had an associate's degree, but they, in order to sit the LEHP exam, they have to have 2 years of public health experience.
Is this to fill that opening?
Yes.
A vacancy?
A vacancy. It's not a newly created. No, I've asked many times if I could have a health educator, or if I could, to fit in the school more, or if I could use cash balance money to start an opioid steroid program, and just to make sure that the county does not want additional support.
We all have desires that we like to.
Because if you could let me spend that money how I want to, I can do good things in this community. Really, really, really good things.
We could add more to put that.
But I don't have the staff to do any more than, they can't take on a lot more than they're doing. But we can wish, right?
Sure.
It's always good to have hope.
Absolutely. Have to,
Yeah.
or you never grow.
Next month I will bring to you the new food ordinance. The state of Illinois has adopted the FDA food code for Illinois. So the ordinance will need to be changed to meet the state requirements.
Food or no?
I call it the food ordinance. It's the exact title of it. It's the establishment ordinance. It's the ordinance where we go and
Food inspection.
do all the food inspections. Yeah. Food establishment inspection. So Kerry has already worked on that. He has sent that to Mr. Devine for approval. Mr. Devine has given his approval on it, has reviewed it, given his approval on it, and I will be taking that to the Board of Health this Wednesday night, and then I will bring it to you next month.
Bring it to that.
I'll bring it to you.
And Amanda.
So on that now, On behalf of the staff of the Iroquois County Public Health Department, I thank those of you who have served your county and are running again for service. We appreciate that you have taken time out of your busy schedule and your life to commit yourself to the other residents of the county. And thank you on behalf of ICPHD.
Thank you. Thank you. Any old business to come before the health department? Any new business? If hearing none, I would entertain a motion to adjourn. It's been moved. We have a second?
Second.
Dale? All in favor to adjourn, say aye.
Aye.
All opposed, same sign. Meeting's adjourned. You ready? All right. Let's call the November 1st, 2016 Health Committee meeting to order. 10:36. All members present, Mr. Whitlow. Are there any public comments? Are there any agencies here to report? Dee, could you please give your report from the Iroquois County Public Health Department?
Yes. I didn't bring you back the contract for you. It hasn't changed from the last time I gave you. We are still waiting on contract numbers, like I said, for EDS. We cannot submit any of the IDPH grants for reimbursement right now because we don't have three contract numbers. No one in the state does. We do have our federal grant number, public health emergency preparedness with from the Department of on Aging, but none of the IDPH grants. We're still unable to send off the WIC EDS, even though we have a contract number with that, because of the new data requirements with the state of Illinois. We're waiting on state guidance for limits for indirect and direct costs for sub-awarded grants. And because we're only one of two sub-awarded grants in the state for WIC, this is new for them too. We've been in communication with them. Linda Butler from the Department of Human Services has recommended that sometime over the next few weeks we set up a conference call between ICPHD, from the Memorial Hospital WIC program, DHS, and the state DOTA unit, which is from the Governor's Office of Management and Budget, to figure that out. Here are the summary reports. Somebody must have got mine with my notes on it. So if you have one that's got some writing on it, let me know. Because I must have handed that out with my, with the back. Sorry. No, I've got extra. I have one with notes on it. No, here it is. Okay. Thank you. So you can see under food sanitation the number of inspections and permits that were issued, re-inspections that were done. The number of water samples was down a little bit this month. We only did 10. Of those unsatisfactory, please don't misunderstand it, thinking that 6 of those 10 were unsatisfactory. Sometimes we have month carryover, ones that were sent in from the month before don't come in. So, you can see the number of wells and inspections and surveys and new wells sealed. The number of radon kits, we're out of radon kits. We have to we ordered them by a case of 100, so we hadn't had to order any for a long time. We're out, so we have to order another case of those. Complaints were down a little bit this month, which was really nice because the staff was extremely busy with normal things. Community health numbers are up greatly, as you can see. Childhood immunization, more than doubled from September. That's because, quite frankly, the October 15th school deadline, the state school deadline for school children to be immunized in order to remain in the public school system. So we'll pass the October 15th deadline, so next month those numbers will go down, obviously. Adult immunizations were up just a little bit. Obviously flu, we're right in the middle of flu season, we're still giving flu shots. To date we've given, I should say as of yesterday, we've given 586. We still have flu clinics going. And 78 pneumonia vaccines were given. 77 of those in October. Under the reportable communicable disease investigation, animal bites were up a little bit. If you'll look under where it says rabies investigations, two of those animal bites required post-exposure prophylaxis. And then as far as the rest of the diseases down the list, you can take a look. If you have any questions, just ask. Under community outreach events, we had 20 flu clinics. 19 of those 20 were outside of the health department. One was an evening clinic here. Some of those clinics were, most of them were public, but a few of them were private clinics where we go to, like, for example, Dr. Martin's office, or to, the art and get flu shots. Numbers are picking up, obviously, for vision and hearing screenings because we're back in session and going. I think the rest of it's pretty much self-explanatory, but if there's anything you'd like me to go over, I'd be happy to do that. We do have an open position at the health department posted on the county website and our page 12 for an associate sanitarian. The position requires a bachelor's degree with 30 hours of 30 semester hours of sciences or 45 quarter hours of sciences. And those are the requirements that the state requires in order to sit for the LEHP exam. We could also hire someone that had an associate's degree, but they, in order to sit the LEHP exam, you have to have 2 years of public health experience.
Is this Bill?
Yes.
A vacancy?
A vacancy. It's not a newly created. No, I've asked many times if I could have a health educator, or if I could to fit in the school more, or if I could use cash balance money to start an opioid heroin program, and just to make sure that the county does not want additional enforcement.
We all have desires, so we like to have.
Because if you could let me spend that money how I wanted to, I could do good things in this community. Really, really, really good things.
We could add more to put that.
But I don't have the staff to do any more than, I can't take on a lot more than what they're doing. Well, we can wish, right?
Sure.
It's always good to have hope.
Absolutely. Have to.
Yeah.
It'll never grow.
Next month I will bring to you the new food ordinance. The state of Illinois has adopted the FDA food code for Illinois. So the ordinance will need to be changed to meet the state requirements.
Food ordinance.
I call it the food ordinance. It's the exact title of it. It's the establishment ordinance. It's the ordinance where we go and
Food inspection.
and do all the food inspections. Yeah,
Yeah.
food establishment inspections. So Terry has already worked on that. He has sent that to Mr. Devine for approval. Mr. Devine has given his approval on it, has reviewed it, given his approval on it, and I will be taking that to the Board of Health this Wednesday night, and then I will bring it to you next week.
Bring it to that.
I'll bring it to you.
And Amanda.
So on that note, on behalf of the staff of the Earth County Public Health Department, I thank those of you who have served your county and aren't running again for service. We appreciate that you have taken time out of your busy schedule and your lives to commit yourself to the other residents of the county. And thank you on behalf of CPHD.
Thank you. Thank you. Is there any old business to come before the health board? Any new business? If hearing none, I would entertain a motion to adjourn. It's been moved. We have a second?
Second.
Dale? All in favor of adjourn, say aye. Aye. Opposed, same